Hello, everyone. My name is Jack Kilgallon, and today I'll be presenting an ongoing study here at CNOC entitled Digital Phenotyping Outcome Measures for Comorbidities in Pituitary Disease, a Sharper Image for Quality of Life. We do not have anything to disclose for this study. Pituitary and endocrine disorders are known to have profound effects on various bodily functions. Currently, the standard outcome measurements of patients with pituitary endocrine disorders are based on post-treatment imaging and laboratory studies. These tests include, but are not limited to, evaluating the levels of hormones and electrolytes such as cortisol, prolactin, testosterone, estrogen, and sodium. However, these measures do not adequately address the many comorbidities that impact a patient's body image and overall quality of life. As you can see on the right, pituitary disorders often manifest in other, more observable ways. The top figure shows one of Dr. Harvey Cushing's patients who suffered from acromegaly, a pituitary disorder. The differences in the facial structure from the picture on the left to those on the right, separated by only 10 years, are clearly noticeable. Likewise, on the bottom, the physical changes that this patient endured as a result of her disorder over the course of only 5 years are staggering. As we become increasingly aware of how aspects such as patient's body image can impact his or her own life, it is important that we work towards quantifying these feelings in order to improve our treatments. To do this, we reviewed the comorbidities that commonly affect patients with pituitary tumors that secrete excess hormones associated with the illness. We identified these to be Cushing's disease, a result of excess ACTH and cortisol, acromegaly caused by excess growth hormone and IGF-1, and prolactinomas, which arise from excess prolactin. We categorize the comorbidity and body image changes for each type of tumor in this table on the right. We then identified certain comorbidities from this list as potentially benefiting from greater monitoring in the form of digital phenotyping and PROMs. Disorders that could see substantial benefit from increased monitoring are sleep apnea and depression. Because our study is ongoing, our final results are not yet available. However, we plan for the various comorbidities to be incorporated into an outcomes process tailored to each. Thus, patients with acromegaly will not be receiving the same treatment and monitoring as those with Cushing's disease. We will design a recommended outcomes assessment process as a pilot study to benefit patients and their caregivers. We anticipate that our assessment methodology will incorporate the use of PROMs and digital phenotyping, such as mobility tracking and text and call logs, to indicate outcomes such as patient recovery or depression. Additionally, we will ask patients to submit a weekly journal, making note of any developments about which we do not think to ask. This process will help us to improve as well as the patient, allowing us to address new comorbidities that would have otherwise been overlooked. The overarching goal of this effort is to provide more effective and focused patient assessment and management. Far too often, the patient's own assessment of quality of life is not incorporated into recovery measures. This project seeks to correct this in the pituitary patient population. With an increased assessment of data, including the patient's own body image feedback and at-home symptom tracking, this effort seeks to improve monitoring patient quality of life beyond imaging and laboratory test scores. Thank you very much for listening. Thank you to CNOC for providing the platform for this presentation, to my co-collaborators, Noah Nwabi and Akira Dewey, and to Dr. Smith and Dr. Laws for their continuing guidance throughout this project.